if you want some evidence of why health insurance premiums are so completely, out of control already, and are consistently getting more and more out of control, all these premiums are being driven from the ground up by the cost of what healthcare services are being charged by the medical providers. I'm going to give you a personal experience, and you be the judge of what's going on. First of all, I'm a very strong believer in bypassing the institutional general practitioners and working directly with what's known as direct primary care providers that take a limited number of patients and for a predictable, fixed monthly fee, you have access to a doctor whenever you need one without having to pay a copay, a deductible, or anything else every single visit. And you know for the year what it's going to cost you. And they will take care of you because they're accessible. Well, bottom line was, it was recommended that I have an ultrasound performed a couple weeks ago. And I was referred to a facility in St. Louis County by the name of Ultrasound First. Now, my general practitioner handed me, a sheet which was a price list of all the procedures that Ultrasound First performs, an actual price list. You'll see the price list up on the screen. That it's like any price list for any product. It lists the specific procedures and what the cash prices are. Now, these are the prices if you go in there and write a check with no insurance card, ranging from $150 to $250 or $225, depending upon what the procedure is. $150, done. $250, done. It's right there on a piece of paper. Now, if you go in there with your insurance card, and let's say you have a deductible of $2,000, $3,000, $4,000, $5,000, your plan is going to be charged maybe 5, 6, 7, 8, 9 times that, and I'm not exaggerating. Depends on the plan, depends on the network, depends on the agreements. But when you use your insurance card for this particular facility, for these particular services, you write a check for $150 and it's over. Now, when an employer controls their plan, they can make these arrangements directly, and these services at these prices are what lays off on your deductible or out of pocket and saves you, the employee, a heck of a lot of money. Saves the plan a heck of a lot of money. But instead, you go running out to an insurance company to get a quote from an insurance plan, and you're going to end up paying a heck of a lot more. Another example of how egregious this system is becoming. I was with a client of ours in Southern Illinois, in a rural community, but not that far away from St. Louis where we're located, and they're a trucking company. And we got into a discussion about various needs, and the owner of the company asked me, they said, do you know any facilities that do radiological services like MRIs or otherwise that we might be able to connect with? And I said, yeah. I said, they're a little further away from you than your backyard. I recommended this particular company, and I showed them the price list. I said, why? They said, well, they were going to a facility that was charging them $300, $400, $500 for what procedures they were performing, when their people needed it. An MRI might cost $400 or $500, depending upon what it was. Some maybe $350, and that's what they were paying. She told me that the lady that is part of the family that owns the company, she told me that the reason why she was asking is because the facility she was going to, was acquired by a major hospital system here in St. Louis. And there was a paper, a sign on the window of the receptionist that said they had just been acquired by this hospital system. Well, the reason why they're asking to know about other facilities, what was $500, and she sent me the actual documentation, and I'd share it with anybody. What was $500 is now $3,500. Same procedure, same facility, same staff. And they weren't losing money when they were charging $500. Otherwise, they wouldn't have been in business. And they wouldn't have had a profitable asset to sell to a hospital. $3,500 a month later, because they went when the hospital system had acquired it, rather than going before they acquired it, and nobody knew what was going on. Let's talk about something else in a little bit different vein, but along the same lines. Just this morning, we had a Zoom conference with an employer that's a small manufacturer up in southeast Iowa. Got about 45 employees. 45 employees and dependents. They told me that their premiums with Blue Cross are $610,000 a year. Think about that. $610,000 a year. And they told me that they were being shown that their costs are being driven by prescriptions, which doesn't surprise me. And that they were evaluating their prescription program, in detail. So I asked them if they were evaluating their prescription program with an insurance agent or a professional licensed pharmacist, because there's an independent pharmacy in their community. I said, have you ever had a pharmacist involved in the evaluation? And so they hesitated. I said, who do you evaluate this with? Their insurance agent. So I asked a simple question. Are you going to get a better result, a better value, better insight, and better guidance when your prescription costs are running at this rate from a professional pharmacist, a licensed professional pharmacist, or a licensed insurance agent bringing you an insurance premium to tell you how good the company is because they're only charging you $600,000 a year? He said, obviously a pharmacist. I said, then why are you going to an insurance agent? Well, that's what happens. Everybody's going to insurance agents to buy health care. Everybody's going to insurance agents for advice. Tell me what insurance agent knows anything about the pharmacy world. And vice versa, tell me what pharmacist knows anything about the insurance world. Pharmacy is essentially a fixed cost anyway, because it's almost all maintenance drugs. And some of the drugs their people are using are advertised on TV. Skyrizi is one, Ozempic was another. I said, you see it advertised on TV, you're paying $600,000 to have Blue Cross, pick up the tab for you. Do you know what Ozempic cost? Do you know what Skyrizi cost? He said, no. I said, do you know what the copay is? He said, yeah. I said, but what's it cost? He said, $50. Because that's all they're exposed to is the copay. $50. Skyrizi is like $6,000 to $7,000 a month. Ozempic is around $1,200, $1,300, $1,400 a month. Plus what the insurance companies and PBMs add to it. Furthermore, when they bundle the prescription utilization into the premium, if that premium goes up 10%, the cost of those drugs just went up 10%. Now, if they buy those drugs directly from their local pharmacist, if the premium goes up 10%, but it doesn't have anything to do with prescriptions, and the prescription utilization cost is excluded from the premium, the cost of those drugs sitting on the shelf of the pharmacist didn't go up 10% on a renewal date. It's the same price. So let's say it's April 1st is their renewal date. The cost of the drug sitting on the shelf of a pharmacy is the same as it was the day before on March 31st. Except if you use a premium, it costs 10% more. And you don't even know what it cost. This is what's wrong. The biggest, we had a very, very nice conversation this morning and really opened these guys' eyes to an awful lot that showed them where so much expense is buried and so much expense is inflated. We have to recognize that there's a cost of health care. We have to recognize that there's a cost of pharmacy. But we also have to recognize that to pay for it with a premium as a pass-through price structure is inflating the cost of that way beyond what is necessary. But the other thing that we really ought to be upset about is what's going on in the vertical consolidation of healthcare services right under our nose by the acquisition of all of these practices by private equity firms and hospital systems. It's unimaginable that a hospital system can overnight raise the price from $500 to $3,500 and nobody says anything. Yet, if the grocery store raises the price of eggs from $3 a dozen to $5 a dozen, it's major news. Furthermore, some of the things that Congress is really, really getting bent out of shape about is really kind of comical. Their latest campaign is the price of concert tickets. They're upset because the price of concert tickets is so high because the tickets are controlled by Live Nation and Ticketmaster. So they're going to save the world by breaking that up. They're also upset about sports teams that are forcing people to pay for viewing their games on streaming services. That's also a very, very major issue. But healthcare going up like that, that's just the order of the day. Because, of course, we have insurance, right? And insurance is going to pay for it. And these wonderful politicians are going to make these big, bad insurance companies pay for, all kinds of things that aren't going to cost us anything. This is going to be free, and that's going to be free. Well, it's certainly free as long as you give the money to the insurance company to make it free when you use your card. But if you don't send all that money to the insurance company, it's not free when you use your card. This whole thing is upside down. The discussion that I had with this employer this morning touched on this particular issue. He asked me what one of the most difficult things were for us to address. And he thought I was going to tell him about things in the medical system. I said the most difficult thing that we have to deal with is to just get somebody like him to take a few minutes and listen to what we have to say. Just listen to what we have to say. We can restructure their plan and save them a tremendous amount of money by just unbundling everything and going directly to the institutional discounts and beyond. The most difficult thing we have to face is being able to communicate and provide information. Everybody wants quotes from insurance companies. Nobody's looking at cost of service. Everyone's trying to solve this problem from the top down. Nobody's getting under the surface and working from the ground up. If you do that, it's astonishing astonishing and how remarkable costs can be improved. When you have information, you have power. When your vendor and your supplier and provider have information and you don't, they have power. That has to change. So if you have any curiosity as to what can be done to be able to mitigate some of the things we talked about. It can't be eliminated, but it can be mitigated, and we welcome the opportunity to be able to share what we've learned with you for you to be able to position yourself to deal with this system in a much more cost-effective way. Thinking back, we have, interesting scenarios. Everybody thinks that they're going to solve these problems with insurance. Does everybody stay with us 100% of the time? And the answer is no, they don't. Now, it's not because the people with whom we're working on a consistent basis, have any problems with what we're talking about. It's when the decision makers change. So let me give you an example. This happened this week. We have a couple of clients that are tied at the hip together, majors in the service industries, and they have boards that change at the same time. The board chairman changes, the treasurer changes, the directors change. It's almost like an elected position. The city government is the same. Councilmen's change, school boards change, and it's political. And when the new people come in, they think they're going to change the world. So the new people come in, they have their own relationships, they have their own ideas, they have their own indoctrinations, and they change. So we just experienced that. Now, what do they change to? Well, their friends tell them they have to have Blue Cross. They have to have United Healthcare. If they don't have that, boy, Armageddon can happen. Well, that's what they do. And as a result, the cost to their employees went up. That's not what they're concerned about. What they're concerned about is, their relationship with the people that they do business with, that they bring in to their system, and the employees and the staff are subordinate to those kinds of decisions, and unfortunately, it's a disservice to them. These entities are going to be spending more, but they think they're going to be spending less because they've been told that Blue Cross United Healthcare gets better deals. Well, when it changes again, they'll be back. Now, we've been the beneficiary of that also, because when a board changes, when the superintendents change, this just happened with a municipality here in Missouri, and new people come in and see it as a problem that can be fixed, then we benefit. But the employees benefit. That's the key. And the employees are impacted negatively when it goes in the other direction. So pay attention to the decisions that are made in the boardroom, because what it costs the people in the lunchroom is unnecessary, but it's still forced down their throat. What people don't realize is healthcare and prescriptions are a product and a service like anything else. And we're buying blind. So to give you an idea of what finally made a light bulb go off is we have a client that's a trucking company up in the Kansas City area. And we'd been talking for quite some time. So finally, I asked the owner, I said, you have a big fleet of trucks, right? He said, yeah. I said, you have a fuel vendor, I'm sure, a fuel supplier for your trucks, right? He said, yeah. I said, how often would you pull your truck up to a pump that didn't have any metrics on it at all? Didn't show you what the price was, didn't show you how many gallons you bought, and then your supplier says, you know what, you pulled up to one of our pumps and send me a couple of $100. You don't know what the gallonage was, you don't know what the cost per gallon was, send me a couple of $100. Or maybe they bill the whole fleet monthly. Send me $100,000. You bought a bunch of gas. I said, would you buy it that way? He said, of course not. I said, well, if you wouldn't buy gas that way, why are you buying healthcare that way? because that's exactly the way you're buying healthcare. You're pulling up to a pump and it has no price. And then when you get finished filling up your vehicle, with healthcare, that's when you find out the price. All right? You're only finding out the price of what the third party is charging you. You're not even finding out the price of what you bought in the first place. If you're looking for what's wrong, there's a mirror somewhere in your house. Take a look. We're our own worst enemy. We do not take the time to get involved in what is happening to us, and slowly but surely, it's going to get worse and worse. It's worse now than ever before. We're seeing the catastrophic cost of treatments for dread diseases escalate at warp speed to numbers I've never seen before. And administrators are telling me the same thing. Numbers we've never seen before. Hundreds and hundreds of thousands of dollars. Last time we were talking about a hospital charging $63,000 a month for a drug that costs $3,800 a month. And the beat goes on. So if we look at things in a practical context, and we look at things in a realistic business sense, the same way we look at everything else, and we look at this through a prism of breaking everything down to actually identifying true fundamental basic expense, the spread between premium pricing that hides everything and actual cost of service is remarkable, and once eliminated, the savings are just as remarkable. I'm amazed that people don't get mad about what's happening to them and just accept it at face value, like this company in Iowa that I mentioned a little earlier. Why do you go to an insurance agent to buy health care? Why do you go to an insurance agent for explanations of why things cost that they are? Why are we not going to the professionals in our communities that provide the service, are informed about the system, understand what's wrong, but we don't listen to them? Let's start going to the right people and stop using the insurance system for the wrong reason. The answer on a group health plan, which is what we specialize in, is we'll show you how to do that. We've been doing this for a long time. So to encapsulate that into a 3, 4, or 5 sentence soundbite is not going to do it justice. There are resources in the pharmacy, medical, insurance, and administrative field that, if used effectively, will reduce costs dramatically, because the insurance company itself is abyss of inflating costs. Look, think of this in terms of building a building. All right? Let's say you want to build a house. And in building a house, you have subcontractors who specialize in specific aspects of building that house, from electric to plumbing to carpentry to flooring to lighting. Everybody's a specialist, and they have a price. Now, the builder is the general contractor, and he assembles the subcontractors together to put the pieces together. Okay? So the subcontractors do the job. The general contractor oversees the job, and the cost is passed on to the purchaser using a general contractor. Now, if that same homeowner built the same house from the same specs, and they bypassed the general contractor and hired the same subcontractors to do the same job using the same specs, that house would cost 25% less, right? What do you think healthcare is? Do the same thing. Unbundle this. All right? The insurance is the general contractor here. The only difference is they own the subcontractors now. They own the pharmacy management companies. They own the networks. And they own your money. That's the worst part of it. So, unbundle it. You own the money. You contract directly with the medical network. You contract directly with the pharmacy directives. You contract directly with an administrator. Now, that doesn't mean that you have to go out and find them. It's, basically the colloquial you. We bring all that together, but we're not the general contractor that charges you for that. All right? The insurance company component does pay us, but if your premium, let's say, is $25,000 a month, the actual cost of insurance within that may be $7,000 or $8,000 a month, and those guys pay us. Everything else is net. And why shouldn't it be? Do you think that an insurance agent should be paid a commission every time you buy a prescription, go to the doctor, get a lab test? No. But in effect, by proxy, they do, because it's all buried and built into and baked into the premium. If you, let's see, if you rent a car, or you have that, better yet, if you have go get a mortgage, that mortgage lender has to itemize every little item that comprises the cumulative cost of obtaining that mortgage and pricing that loan. Every little detail, right? Okay. Now, let's say that when you went up to your pharmacy counter, that pharmacy was required to show you what the cost of that drug is, net, and what is added to the cost of that drug with insurance. So let's say that drug cost $100. But, using the insurance paradigm, the cost of the drug is $100. The commission paid to a broker through premium is, $6. The administrative costs for the insurance company to handle all the paperwork might be $18. The pharmacy management company might be another $10. And any other ancillary service, okay? Now, add all that up. The drug is $100 if you hand a $100 bill or a check across the counter. But if you hand your insurance card across the counter, the cumulative cost with all those little add-ons in it that I mentioned really nets out to be about $130. But it doesn't seem that way because your copay may be $15. But it's buried in the premium. This is a brilliant, marketing scheme that is literally hypnotized this whole country. It's incredible. And it's financing the political campaigns of our politicians, so they're not going to do anything about it as much as they scream and yell. They're in front of the camera, and they're everybody's best friend. They're behind the camera, and they're everybody's collection plate. That's the system.